Morning, assalamu alaikum, very good morning. Okay, my name is Mustafa. I'm a surgeon. I'm an upper GI surgeon, so Bahagian, esophagus and stomach and all these, and I do a lot of bariatric surgery, weight reduction surgery. And because of my field in the nutrition, so I'm a dietitian as well, and we do what we call stem cell therapy. So I've been with Dr. Widya for last few years, and we've done a lot of treatment in KL, Kuala Lumpur, for certain type of patient. So what I'm going to do today, I'm just going to talk about the breakthrough in stem cells. So I'm not going to talk a lot about what we call a lot of many examples, but I'll talk about what is the stem cell in order for us to understand what is the stem cell, in order to know how to treat stem cell. Okay. When we born, I don't know if it's going to work. Yes, good. When we born and we are very young, we are still able to repair our tissue damage. All right. Now, after we get older, we will be able to heal wounds. Okay. Now, the idea that we lose within age is actually we don't able to regrow things again. So the idea of the stem cells has come from the idea of if we can regrow part of our body. We know there are certain organs in our body that can regenerate and regrow itself, but to certain limits. So now when the idea is come up, okay, why can we just try to get certain part of our body that can be regrow again? So why we accept the idea that when we age or when there are certain changes that happen in our body by we are age of 30 or 40, can we reverse that or no? This is the idea what has come for all the wellness and anti-aging. So I'm taking one part of it today, and I do believe that Dr. Amanda she talked about and Dr. Widya she talked about. I'm just going to take the part of the stem cell therapy. So let's take one idea. Do you know that in our body there are more than 10 trillion type of cells? And those from all these 10 type of trillion cells, there are two original 200 different type of cells. These are the type of cells that we are talking about that can be regenerated. And this is the idea when it is come back from the stem cell. Let's take an idea. There are different type of cells in our body that actually can give the code for the cells from all these like 10 trillion cells in order to regrow back. And these are the stem cells. Then now, when we came to the idea that, okay, if we are able to extract these stem cells and reuse it again, then we are in somehow we are going to regenerate a good health for ourselves. So now we do know that the stem cells only grow up when we are only fetus in the intrauterine life. So I'm going to take an example. This is actually a womb, okay? They call it planaria womb. This planaria womb actually is very simply contain its own stem cells. All right. So this is stem cells. What is good? If you cut the head, the tail will grow up. So the stem cells is actually just distributed from the head to toe. Just I make it like that. Now, from this idea came actually, if we are able to use this stem cell to regrow part of our body, then we are good to generate a new health for ourselves. Then now, can we actually, and there were a lot of studies to regrow back part of the bodies, especially for those people who got amputations during the war. There's actually the studies started a long time ago. So they've been able actually even to grow up ears, nose, nerves, and they be able to reach to that level. Then they actually, even they reach to the level for something more complex, even in bladders. So these are the things they're able to do it. So now, how close we are to disciplinary wombs? That's what is the whole idea of the stem cells actually. So the studies started in a very long time. It started maybe even from 60s. But the first time when they're able to start to harvest type of the stem cells, it started in the 90s. But this man in 2006, Shinya Yakama, he is the Japanese guy who is the first time able to extract type of expand or advanced type of stem cells. And this man, he is the one who actually able to use these stem cells in a good manner for regenerate part of our organs. Now what we're talking about, there are a lot of famous characters all over the world who supported these type of stem cells, because we know eventually these type of stem cells have for own patient betterment. So when we talk about the stem cells, this is a very big thing when we talk about, but there are a lot of criteria that carry over the stem cells, and these type make it into two. Type number one, that these cells, all of them, they can renew themselves. So the one can get 2, 2 get 4, 4 get 8, and 8 get 16, and so forth. And the other one is actually when we talk about the differentiation, was the point before last. So the cells, now when we give one stem cells, that can actually differentiate into different type of your body. Now when we talk about in the medicine, when we have a patient who have, let's say for example, some disease, and that disease, let's say for example, he's got a diabetes, and this diabetes, we know, as we reflect back to the endocrine part of it. If you are not able to correct all the endocrinology part of it, then you know very well it's actually go to the gland of pancreas. And that's because the gland of pancreas either have a failure or there is some resistance to the insulin secretion. Well, those people who have failure of insulin secretion, they are good candidates for stem cells. For those people who have insulin resistance, they have to come and see Dr. Widya, because they have a lot of hormonal imbalance. So the resistant part can be managed. But if you have pancreas secretion failure, stem cell is the treatment. Now, if you combine both at the same time, you can go to cure level. So this is the beauty of stem cells. Instead of talking about something is just of manipulation of management, you are actually talking about the cure. Okay. Right? Okay, now, where we can get all these stem cells? These stem cells that are everywhere. You keep in mind, what we are talking about here about adult people. We are not talking about unit. In unit, they are just a piece of stem cells. Now we are talking about people who are adults and start aging by the, let's say they are mid-40s or middle age, they start to lose. So they are not able to regenerate. So now we know very well we can harvest the stem cells from all these parts: teeth, skin, heart, gut, liver, bone marrow, peripheral bones, skeletal muscles, blood vessels, brain. And if we are able to harvest the stem cells from all these organs, we can treat back all these organs. So that is actually to tell you how wide the base for you to manage a patient who have any disease with the stem cells. Into brackets, there is no limitation if you think about anything that you can treat with the stem cells. Okay? Now the abundance of how many stem cells or the type of the stem cells between the organs are different. Now we come from the principle, they said, okay, then you are taking a stem cells from the person who is already sick. So now we went to more stage higher than that. We are not taking only from the person himself. We are taking from an adolescent, a younger age, with a very young and clear stem cells. Yes, please.
Yes. When is the best time to take these stem cells in terms of the age?
All right.
You mentioned before that it should be better to take the stem cells therapy when our cells cannot regenerate, if I'm not mistaken.
All right. It's a very good question. Okay, now for you to time up when to give the stem cells is depend on whether you are a sick person or you are a healthy person.
Let's say I'm a healthy person.
So okay, when you are a healthy person, you know very well when you reach the level that you already have a difficulty to get the balance of your hormones. And that is, we know very well, it is started by your middle age. So when we talk about the middle age, we are talking about the 40s and above. Now, if we go one step behind, okay, there are a lot of changes that happen in the 20th, 30th, 40th, and 50th. So now, in your 50th and above, they are all follow one standard, all right. Between the things that has happened in your 30s and 40s, that is very much reflected to your style of life. Let's say, for example, meaning of the thing that may happen in your 40s, it may happen earlier. Why it happened earlier? Because you are bad. Your lifestyle is wrong, your eating is wrong, you are not doing the right thing. Still, you are a person free of sicknesses, right? You don't have any disease. Now, the thing that may happen in the 20th, you can make it in your 50th because you are very good. You are really taking care of your life. So now, but we know the borderline is actually in the between 40s and 50s. So those people who are taking for wellness, and that's what we recommend usually. We go usually by body size, which is good for Indonesian because small size we don't need to give them a lot of stem cells. It's a bit more cost effective. So usually we recommend for them to take what we call every 2 to 3 years, one single dose. And that will be in a matter of like 50 million to 70 million. And if like we have good people who are like small size, we can divide the dose like what we did for the last 2 patients. We give them 50 million each. Because the package is coming 100 million cells. All right. And I'm going to tell you why we don't go more than that number.
So
Right.
normally 40 to 50 is the best.
This is in case that you don't have any sickness.
That's right.
All right. So it's just you want to go one step ahead before the things happen. Keep yourself high, and that's because we are talking about your memory cells. You are talking about your all the degenerative diseases before it start to happen. Then it is time for you, because in this lecture I'm going to talk mainly about men. That's what because in the afternoon I'll talk about women.
Sorry.
One thing.
Terus.
Before we take these stem cells, do we need to, let's say, improve our healthiness? Let's say, I want to take these stem cells, okay? Will it be better if I delay for another 3 months or 6 months? And I will do some exercise, I will do to take some supplements to make my health becoming better.
All right.
Because as far as I know, stem cell is taking from our cells in our body. Is that right? No?
I told you we stopped doing that.
Oh,
I'm going to that. I'm coming to it.
Okay.
I'm coming to it. Okay, I will answer you in a while. I will answer you in a while.
No. After that.
Alright. Okay, now, when we talk about how you manufacture these stem cells, now in Malaysia, we have only one authorized lab by the Ministry of Health. That's our lab. That means the cells, whatever you got, it is go into very recognized steps, and all this step is being authorized by the Ministry of Health. Okay, now, when we take the cells, we are not taking the cells from adults. We are taking from adolescents. We are taking from age between 4 to 6. And ask me why. We don't take from fetus newly born because the cells are very fragile. And we don't take from more than that age, that means adult people, because the cells will be difficult to harvest because we culture the cells, so it's difficult for us to divide them. All right. So now we found that best age is actually in that adolescent. We take it between age of 4 to 6. And from all the numbers of the cells, from all the way of how we harvest from all, we found after all we just take it from the teeth. And that's what we do in our lab. We take it from the teeth for the dental part. For those kiddies, when they are age 4 to 6, when the teeth start to fall off, we take the teeth. This is actually a university project. Then we start to take the cells and we harvest from there. So it is go into steps. So these are the steps that is passed through till the last week to give it to the patient. From step number 1 to step number 7, it takes around 3 months.
Excuse me. I just want to know that because I'm pulmonologist. Not all organ you can make a stem cell, except 2 organs you cannot make a stem cell, including the lung and the renal. Is it alright?
Yeah, that's true.
But why?
Okay, and somehow, because we are going to talk about what the type of stem cell that we use, and that will answer your question, especially for the renal process.
Yes.
All right. Okay. Now, between this step and this step, it will go around like each step will take 2 weeks to 3 weeks. All right. And between each step, when you are going to get the cells, and the last step, you will get a certificate that your stem cells pass each one of these steps successfully, including all the sterilization. And thus we are authorized by the Ministry of Health. That's the recommendation from the Ministry of Health, Malaysia. All right. So now, in order to get all these steps, and we talk back to your genetics, we know very well, if we talk about the commercial part of it, stem cells is very expensive. In order to get the stem cell to the last minute, which is actually, you talk about 100 million cells, is only 2 cc. It's not a lot. You get it in a big box, but inside that box is only a 2 cc. We use a special syringe and a special needle because the cells are very fragile. Okay? So now, in order for you to get that number of cells, you have to go into divisions. We call it fast cycle. All right. So now the facet, in order to reach to the millions, you need to reach to facet 4. All right. What does it mean? These are the divisions of the cells. All right. The culturing unit. Once you go more than facet 4, your stem cells will start to be genetically unstable. What does it mean? That the stem cells can be actually, maybe can be carcinogenic. And that's what we get it from the genetic test. So that's why all these stem cells will go through a genetic test in the lab. We don't say it anyway, it's in the lab. All right? So we don't give more than facet 4. And because facet 4, if we are talking about 1 million stem cells, we can get actually 10 million stem cells. So actually the price can really drop, but we cannot go further than that because the cells will be unstable. That means it is dangerous to give it to the patient. All right? So now, we have already made the stem cells. So the moment that we are decided to get the patient, we just need like at least a few days to get the confirmation. Then subsequently we will release the cells on the day of the injection because the life span of these stem cells is only 6 to 8 hours. These are human life stem cells, no animal preservatives at all. So that's why they are non-allergenic. Doesn't cause allergy. We don't need any sort of testing, HLO typing or HLI typing whatsoever. All right, that's why this implantation is quite safe. These are the things that you are going to get in the certificate: the morphology, viability, sterility, bacterial toxification, mycoplasma. All these tests will be given to you in a certificate with each type of stem cell that you are getting. Basically, we are using mesenchymal stem cells. All right. These are some of the methods that how we, from the bone marrow, this is a general about stem cell, but we don't do that basically because we take from the, mainly from the dental part. We have a project now is running on with the university for all the blood diseases, and for blood diseases because now we are into bone marrow transplantation. So bone marrow transplantation, we just take from the patient himself because we need the genetic code for it. Because those patients, thalassemia or patients sickle cell anemia, they have genetic diseases. This will be the best if you hit them back with their own genetic code. So those people usually will take their own stem cells. All right. This is how we do it. This is actually what we call the dental part. So you see that we take it out from the dental part. Okay. These are the small material that we take it from here, and this is actually the small gelatinous material. We take it from the part. Then we harvest the cells and this will go through there. Okay? There is from the adipose tissue, but adipose tissue problem is actually considered as a surgery, and the amount of the cells that you get from is not that many. So that's why we have to take a lot. Alright? We can take it from the blood as well, the peripheral blood, just your normal peripheral blood. Alright? We can take it from the cord. We can take it from what you call Watten's jelly. This is the Watten's jelly from the baby as well, or the blood of the cord itself. Right? All right. All these cells, this will be preserved in the lab in a nitrogen preservative to minus 190 degrees. All right. And we actually, even in Malaysia, in our lab, we can actually sign a contract with the family if they want, to keep the cells for 30 years, 40 years, whatever, for the kids when they're born, and they can use it later forever, right? Maybe for themselves or even any member of the family. Okay, now, what are the main 3 factors about it? We said that the cells actually have very easy, it can replicate the cell, it can differentiate, but let's take just a very simple idea about it. We have tissue stem cells, we have embryonic stem cells, these are from the baby, and we have, this is actually the advanced induced pluripotent stem cells. And this is actually surrounded by our mesenchymal stem cells. All right. For tissue stem cells, back to your question, for lungs, we don't have.
Why?
Okay, because so far, we couldn't actually harvest from the lung because to get the lung, you need a tissue from the lung, and the problem tissue from the lung is a surgery. Now there is a study in UKM we are doing with the cardiothoracic unit, and that's actually what we are doing.
No, excuse me. That you said that difficult to get the lung tissue
to sample, yeah, because it's
very easy for me. I just make transneedle.
It's invasive. It's
yes.
Invasive.
Huh?
Invasive. We always
inpatient.
yeah. So it's ethically is not acceptable. We are doing, we are still doing experiments. So medical legal, we have to start on animals first, right? But for human lungs, so far we couldn't get because for the ethical issue of it. So we don't have. So now, currently, which is actually is at the end of the study, they are harvesting from the cardiothoracic patient for all the open heart surgery. They are taking from the sternum, and in order to get these cells for the cardiac part of it, so to inject for those patients who have myocardial infarction. And the second part, they are taking lung tissue as well. They are looking for all those patients with thymoma and pulmonary interstitial diseases. And this is what we call about the tissue stem cells. Now, embryonic stem cells is the lowest in meaning of quality, but embryonic cells is very good if you individualize it. What does it mean? You take from the skin to the skin. You take from the bone to the bone, like that. So it doesn't have the capability to have the differentiation by its own. And now what we use mesenchymal stem cells. Mesenchymal stem cells, one thing good about it is actually we call it genetically clever because it actually can go to the cells without any code, and it will take the code from the patient himself, and it will go and treat the organ. And now those people who have, let's say for example, any sort of disease, we don't stop doing tissue cells because it's actually tissue cells we can give only like 1 million or 2 million, but you cannot give like 100 million as we do in the induced type of differentiated cells. It's actually the science behind it a bit complex, but now we simplify it to the level that we know that very well. The best is actually you go for something is easy, non-allogenic, it can differentiate by its own, and that's what we are giving almost like what we call mesenchymal stem cells. Now the differentiation part of it, we just exclude from that. You have to understand we are talking about 3 categories. Category number 1 for people who are healthy. Category number 2, people who have sicknesses, but these sicknesses doesn't need an intervention in meaning of need a special type of cells. And the category number 3, which is the cancer. Cancer is totally a different story. Cancer, we are talking about natural killer cells. They are also still stem cells, but the problem with that, we need to harvest from the patient because we need the genetic code, all right? And we give, and we know that we have the NK cells in our body in a number of million. We harvest the stem from the patient himself. We give them back in a number of billions. And that will actually augment the, especially if we talk about mesothelioma, all these type of cases of small cell carcinoma, this type of cell that even the radiotherapy, chemotherapy doesn't work on it, then they have no choice just to come to the level of like some sort of stem cell therapy, and that's what we are doing now actually. All right, so what I took actually, that's what Dr. Vidya is doing now, all this regenerative medicine. Now we are talking just a part of which is in between. This is what Dr. Amanda talked about, the immune therapy. The cellular therapy is called actually stem cell is fell under stem therapy. Tissue engineering now is overlapped with the cell therapy. All these things is just, I left it the headache to Dr. Vidya. I just take part of that only. All right? Okay, now, just a few examples I'm going to give in order to let it open like what's going on in the world. You know that now health tourism, stem cell tourism per se, is a 3 billion a year. And this is study actually 2011, and now definitely is more. All right? There are more than 700 clinics all over the world, and it's actually shift the paradigm in when we're talking about the organ transplantation, because the stem cells is actually devoid a lot from all these diseases. Now when we talk about, let's say for example, people who have leukemia, people who have like all this thalassemia, when they used to do the bone marrow transplantation, and this is a very complex procedure, now no more. Now we have a study for the PDs, is actually what we are doing, we give them a chemotherapy. So the chemotherapy is actually bone marrow ablation. So we kill the bone marrow, then we shoot them with the stem cells. That's it. That is already the implantation, as simple as that. It's actually, that is just a combination things which is actually come out with a lot. Okay, now, the possibilities around it, any organ and any related to the organ, all can be treated by stem cells. And that's when I said is actually there is no limitation, there is no limitation. All right? Major diseases that is meant to be like treated by stem cells, there are 65 major diseases that can be treated with that. And I'm not going to go into the details about it because we just wanted to understand what is the stem cells, what is the idea behind it. All right, a bit of man, when we talk about it, okay, is you have to understand, man personality maybe is a bit simpler in meaning of the biochemical and hormonal status of it. Female maybe is more complex, but actually functionally man is more complex than woman. Alright. Now you need to know 8 facts about men, and that is actually men always live shorter than women because they are crazy sometimes, right? They do all this stuff. Right. But this is actually not the idea because of the risky stuff, but it's aging wise in female, and that's because they live shorter. If you go to the older living residents, 1 in 7 actually men, the majority are women. Alright? Usually when you talk about the happier lifestyle, usually men is happier than women. And that is actually we call for the complexity of the hormonal status behind it. Right. Now they are less apprehensive about aging, alright? And men, they are always in their denial. So they will tell they are age in later age. So the female, they will start about her age by her 40s. Man will think that he aged when he is in his 60s. Am I right? Which meaning of, if you come to the clinic to wellness, you will see majority of patients they are female. Because they care about themselves earlier. So the men, actually, they believe they are aged a bit later. These are facts, so this is not my words, okay? Right. Okay, now, but interestingly, after all, they've got the same sicknesses. In spite of when they start taking care of themselves, 20 years earlier maybe, but still they can get back. Alzheimer is actually, both of them have the same, but they have more high risk of vascular dementia. And vascular, this is when you talk about atherosclerosis in general. Okay? Older men, they are satisfied with their sex life is more than women. Okay? And usually, men, they still fit in meaning of physical fitness is higher. Now, these are just a few slides, 3 or 4, only just to tell what we can do with the stem cells for men. All right? Hair growing, and this is already established now, we have many ways to use. The best one is actually we found it is not the systemic, is the local.
Hair growing?
Hair growing, yes, we can do that. No color promises, only hair growing.
Dr. Mustafa,
Yes.
is there any correlations between these stem cells benefit with the longevity to increase the lifespan of human?
Yeah, that's for sure. The idea behind it is we cannot tell that. We are not gods. Okay, we do believe that is whatever been mentioned to you that you'll die on your time. It's just that we can assure a better quality of life.
Just a better quality of life.
Better, for sure. That's for sure. That means you live dementia all that time, but you can live with a good memory.
And also the malaikat, you know malaikat?
Yeah.
Goes to the wrong man.
That stem cell doesn't help.
Yes.
Yeah, I mean, it's definitely it does. Meaning because now, what we found for all those patients, let's say who are healthy, wealthy, and they don't have just take the stem cells. The first thing that they have experienced is actually the feeling of being well, and meaning of activity and whatsoever. So they have 2 weeks of being well, then they will go down back to normal for almost 6 weeks, then they will pick up again. Okay, now we don't have a true physical things. This is more of testimonial to tell they will have the best response after 6 weeks to 8 weeks, and that will be 2 months. Why? Because actually the cells, in order to replenish itself inside the body, it will take around 6 weeks for the proper reaction. And this is the best time to get the response from the patient himself. So you don't expect, okay, take it's not a nitrogen, you do, that's it, you fly out. This will need time for the body to react to it. And that's when we talk about, okay, if you tell, okay, I'm getting only 50 million, not that much, it's actually the 50 million, it will divide in your body into many and many and many. And that's many. Where it will go, now because we are using the mesenchymal stem cells, we cannot really tell because it will be absorbed by our body, which your body will call for the necessity for it. So that what to tell, I mean, we are not giving what we call dermal cell. Dermal cells, let's say you have a skin problem, you make it like a dermal cell, then you take it to the skin. You know it's going to the skin. Now when we give in the systemic review, it will go and more into absorbed by the body rather than. back to your question, whether it is increase or prolong the life survival, there is not a such study work on it, but from the quality of life is 100% assured. Definitely. This will improve the quality.
One another question. Assuming that using the stem cells, our cells in our body will be regenerate. Okay. Will it affect, let's say, our metabolism's capability, like in the 20s or 30s? Or it just make our cells becoming healthier, but our metabolism, let's say, for men like 50 to 60, their metabolism should be going down, slow metabolism. Can we make it exercise metabolism like?
Oh man, you want to boost your
Let's
metabolism.
say, let's say.
Okay, metabolism is a very complex mechanism. I play this game for my obese patient, but one thing about it is actually you can improve your metabolism by two main things. The quality of food that you take. So you have a food that is actually all the time is actually need to be absorbed very fast in the body, and that's why people that emphasize on taking like veggies and all these things, less fibers or less red meat, because these are the number of the protein fibers inside is very high, will take longer time, and this will always delay and delay and delay. Okay. Sorry?
Because it's food. The second
That's food. The second one is actually your lifestyle, meaning of sports. All right. So now for people who have a problem with their metabolism, when you give them a sports, you cannot just say, oh, you need to exercise, you can go and run. No, that doesn't work with them. It's not going to improve their metabolism. It will improve their pumping action, make their heart better. They make actually meaning of fitness, they will be better. But if you are talking about how can you increase the metabolism, that is a totally different game. You have to go on, in exercise we have 4 zones of, it depends on your heart rate. That will be your blue zone, your green zone, then you have orange, then you have the red. So those people you want to increase their metabolism, they have to be on the orange or red and all the time. And actually that will be a matter of exertion. That when you exercise, you feel you hardly you can take your breath. That is actually the thing that increases your metabolism. Let's say, for example, if somebody, you want to increase their endurance, somebody can run 5 km. Okay, how can you make him run 10 km with the same speed? All right? You don't ask him to run every time, okay, now you run 5, tomorrow you run 7, then you run 10. No, they are not going to improve that. They will make 10, but with lower time. You ask them to run 3 km with a fastest speed. That is actually will improve their endurance. So always you have to play the different game behind it. So now, if we talk about stem cell per se, when it is increase your metabolism per se, it is a very good anti-inflammatory marker, right? And it's the first thing, if you want to see the improvement in your body after you take stem cells, you try to check your PCR. Or this is the protein, one of the inflammatory markers that we talked about just now, Dr. Rujia talked about it, okay? Or you can, if the PCR is very difficult because it's a DNA related, you can do something is much easier, which is CRP, C-reactive protein. C-reactive protein is actually something is very simple to check. You can check yourself before and after. You may not have the CRP is high, but you will see there will be drop in the CRP after you take it. Now, when you talk about the stem cell, for example, when you talk about for the knee joints, as for the knee joint, they said that actually, it can regenerate the cartilage. This is just a bullshit. I'm sorry for the words, but it actually doesn't do. It is the best anti-inflammatory marker that you cannot achieve with your HA or PRP or any sort of steroid that you give. And that's why what we do now, some orthopedicians, what they do, they give like the washout, arthroscopically, they make a crack in the cartilage. They inject the stem cells. The cartilage, you go back to its normal size, which is actually give you more space and you have the laxity. But the endurance of that is very low. Then you go back to strengthen your muscles, lose your weight, then you have a good outcome from this. So the best thing from the stem cells, apart from whatever it does as a gene related, is a very good anti-inflammatory marker, which is actually that's help people in order to improve your other part of the body if you are talking about your metabolism or whatsoever. So it's actually is always, that's why I said, when you use it for disease, we know it's targeted to a disease, but if you are using only for well-being, it's have a totally different meaning, which is always for betterment. All right. All right. There are cells where we talk about the neuron cells, and we know the neuron. That's when we talk about any permanent damage for those people who they get stroke, they get any sort of disability, accidents whatsoever, and there is a study, a lot online. It's all show, but in Alzheimer we have a very good, and we know very well that Alzheimer is a regenerative disease, and most of the time we are reaching almost to the cure of Alzheimer, and with using all the stem cell therapy. All right. For now, this is the big hoha about the stem cell therapy, and this is what we are talking about in men with azoospermia, that they don't have sperms at all. Now they reach to, because they found actually a new biomarker in the testis, and if those actually, it can help to give rise to new sperm cells. So those people, they cannot just get babies by normal, but at least from azoospermia, no sperm, they can get a new sperms, they can harvest the sperms, they can use it in IVF or even in the what we call IUI, the intrauterine insemination. Okay, this is actually making a big hoha now, and is actually helping a lot. It's been established for the treatment of erectile dysfunction for men, and there are big promises behind it, and they see like reported positive effect in erectile function using the stem cell therapy. And there are actually, which I believe Dr. Vidya is going for this, the World Meeting of Sexual Medicine soon, right? That will be in Morocco. They are emphasizing on all this type of thing. There are big studies about it. This study is actually established in China. Too many now. We are getting the new device is the stem cell spray. It's what is actually we just spray the stem cells on the. But this patient actually is no, he didn't use the spray. He just used the systemic, because we know it's very good for angiogenesis and improvement of the blood vessels. And there are a lot of talks about treatment of all the joints and muscles injuries and all using the stem cells. I do believe there are a lot of famous people who had all through this thing. The states has already proposed the treatment even in India. They have a big establishment in India. The treatment all the time is actually, they can do it ultrasound guided. Simple, can be done under daycare, but now even we are doing simpler, we just do it in the clinic itself. It's not like even doesn't need an ultrasound. We have a new device, is actually a intra-articular laser. So that when they put the needle there, they inject, they leave the needle, then they have a microfibers that go inside, is a very good, can help the uptake and absorption of the stem cells to the joints. Too many famous players in the world, they have a stem cell therapy. Nadal known to have a very bad back injury, and he already have received a stem cell therapy for his back. This is the new study what we are talking about actually, but it's already established in a different way about the infarcted myocardium, but this one they inject to the myocardium itself under what you call ultrasound guided. In summary, it potentially can treat any type of diseases, and now is actually shift the paradigm in the treatment of an organ transplantation. Is the best anti-inflammatory agent that is actually modifies stubborn types of immune diseases. That means all those people who have sort of like, you know, lupus nephritis, SLEs and all this, they have autoimmune diseases, skin, eczema, all this. Stem cells doesn't cure, but it will modify the immunity. So instead of giving steroids, when you know how it's harmful, is the best anti-inflammatory marker is actually you give the stem cells, and it established its role as in a well-being and anti-aging, and still a lot of research is going on, and hope we can get more for the outcome future. Thank you very much.